Failure to thrive in the elderly is a cause of death. This video is for informational purposes only and should not be used in place of the advice of a medical professional. Failure to thrive in the elderly as a cause of death is a complex medical condition characterized by a decline in physical function, weight loss, and mental health issues such as cognitive decline and depressive symptoms. Identifying failure to thrive is crucial as it may precede a further decline in older adults' overall health, potentially leading to an emergency room visit or even becoming a listed cause on a death certificate. Understanding failure to thrive in the elderly. Failure to thrive in elderly people is a complex diagnosis characterized by unintentional weight loss, decreased appetite, and physical inactivity, potentially accompanying poor nutrition, and other signs of health deterioration. A variety of diseases and conditions can be associated with failure to thrive in elderly patients. Chronic illnesses, such as congestive heart failure and chronic infections, often play a critical role. Elderly individuals may also experience a decline in physical function, cognitive status, and social interactions, which can contribute to risks for falls, hip fractures, and decubitus ulcers. This condition can often lead to social isolation, further deteriorating the quality of life and increasing the need for medical interventions such as hospice care or emergency room visits. Etiology of failure to thrive. Physiological factors. Older adults often experience a reduction in body weight and muscle strength, largely due to poor nutrition and chronic diseases such as heart disease or chronic infections. Functional impairments, such as a decline in physical activity, play a sizable role in the etiology of adult failure to thrive. For instance, cognitive impairment and decline can lead to diminished food intake and malnutrition, which are critical risk factors for functional status degradation. Psychological factors. Depressive symptoms are highly prevalent among elderly patients and are a significant contributor to the syndrome of weight loss and failure to thrive. Depression in old age is not just about mental health but can also impact caloric intake and the motivation for physical activity, leading to a higher risk of mortality. Social and economic factors. Socioeconomic status exerts a profound impact on the health of elderly people. Economic hardship can limit access to adequate medical care and nutritional supplements. In addition, a lack of social support can result in delayed medical interventions and a more frequent need for emergency room or social admissions. Clinical manifestations. As you explore the clinical manifestations of failure to thrive in older adults, it's critical to understand how it presents through various symptoms. These include changes in physical health, cognitive and emotional states, and social behaviors, which are integral in pinpointing this syndrome. Failure to thrive in the elderly often involves significant weight loss and malnutrition, which may be compounded by dehydration. In assessing physical health, look out for a sharp decline in body weight, more than 5% of the baseline, which can lead to further complications like decubitus ulcers. Cognitive and emotional symptoms. In the domain of mental health, cognitive impairment and depressive symptoms signify a failure to thrive. You might observe diminishing cognitive status, such as confusion or delirium, which are warning signs of serious health conditions. Social symptoms revolve around the individual's engagement with their environment. Withdrawal from social interactions and a possible lack of social support from family members are indications of a potentially broader decline. Diagnostic approach. When identifying failure to thrive in elderly patients, a comprehensive diagnostic approach is pivotal. This process often begins with a diligent medical history review and a careful physical examination, followed by pertinent laboratory and diagnostic tests to uncover underlying health issues that may contribute to the failure to thrive. By adopting this approach, healthcare providers can better understand the factors contributing to an older adult's deteriorating health, be it due to physical, mental, or social challenges, and thereby guide interventions and, if needed, palliative care decisions. Therapeutic management and intervention. As you navigate the complexities of failure to thrive in elderly patients, recognizing the importance of comprehensive therapeutic management and interventions is crucial. These approaches tackle critical areas such as nutritional deficiencies, medication impacts, and essential care coordination. Nutritional support and management. Proper nutritional support is paramount in addressing failure to thrive. A dietitian evaluates food intake and recommends a diet tailored to increase caloric intake and combat poor nutrition. They may incorporate nutritional supplements and ensure you're receiving sufficient macronutrients and micronutrients. Pharmacological treatment. Effective pharmacological treatment involves the judicious use of medications to manage chronic diseases and alleviate depressive symptoms that contribute to adult failure. Your healthcare provider should review all current medications to mitigate medication side effects that might affect your appetite or energy levels. Multidisciplinary care teams. Multidisciplinary care teams play a critical role in the collective approach to your care. This may include a social worker to address social isolation, an occupational therapist to aid in improving your functional status, and a physical therapist to promote physical activity and enhance muscle strength. The team works together to ensure that all aspects of your health, from mental health to physical function, are managed with an individualized plan, fostering an improved quality of life and potentially influencing mortality rates. Challenges in management. Detecting and addressing comorbidities. In managing geriatric failure, it's crucial to identify and treat chronic concurrent diseases that contribute to the syndrome of weight loss and decline in functional status. Older patients often suffer from conditions like congestive heart failure, chronic infection, or diabetes, which can exacerbate poor nutrition, physical inactivity, and cognitive impairment. Navigating polypharmacy and side effects. Elderly patients are often prescribed numerous medications, putting them at a higher risk of medication side effects and complex medication interactions. Certain drugs, especially antidepressants like SSRIs, can inadvertently worsen poor nutrition and physical limitations through side effects such as loss of appetite or nausea. Outcomes and prognosis. When exploring the outcomes and prognosis of failure to thrive in the elderly, it is important to understand that this condition often exacerbates morbidity and can increase mortality rates. The resolution or progression of failure to thrive is closely linked to the management of underlying factors such as nutritional status, chronic diseases, and social support. Morbidity and hospitalization. Morbidity associated with failure to thrive in elderly patients often involves a decline in functional status and cognitive impairment, as well as increased hospitalization. The Institute of Medicine highlights poor nutrition and physical inactivity as factors that may precipitate hospital admission, particularly in cases where geriatric failure is pronounced. Mortality and cause of death. Mortality in older adults with a diagnosis of failure to thrive is considerably higher, with acute events such as heart attacks and complications from chronic diseases like congestive heart failure often being the immediate cause of death. Depressive symptoms and social isolation can also contribute to a syndrome of global decline in older patients, increasing the likelihood of early mortality. The death certificate typically reflects various contributing conditions rather than identifying failure to thrive as the sole cause. Preventive strategies and public health. Effective preventive strategies in public health can significantly decrease mortality rates among elderly patients by focusing on maintaining activities of daily living, strengthening the social network, and combating ageism. Enhanced community and social support can mitigate social isolation and its associated risks in older adults. By promoting initiatives that foster social interactions, family members and caregivers can build a robust support system for elderly persons. Initiatives like senior centers and social worker engagement programs help maintain cognitive status and reduce depressive symptoms. Furthermore, it's vital to educate communities on recognizing warning signs such as sudden loss in body weight or functional status to ensure timely access to medical interventions or hospice care. Health promotion and aging policies. Health promotion tailored for elderly adults involves comprehensive public health strategies including regular physical activity, addressing poor nutrition, and providing access to nutritional supplements. Aging policies should prioritize preventive care to manage chronic illnesses, like congestive heart failure and chronic infection, to enhance the overall health of the elderly. Future directions in research and treatment. As research progresses, the understanding of failure to thrive (FTT) in older adults requires sharpening, especially in designing effective treatments that can reduce mortality rates. Studies must continue to pinpoint the intersection between chronic diseases, such as congestive heart failure and chronic infections, and elderly patients' nutritional and psychological state. Thank you for watching. To read the full article, go to livingyourSeniorLife.com. The link can be found in the video description. This video is for informational purposes only and should not be used in place of the advice of a medical professional.